Okay, welcome, welcome. If you're able to be on camera, awesome, since it's a small group, but I understand if that doesn't work for everybody. But there will be a part of this class that's interactive, and I guess no right or wrongs. Just I think the more that you participate, the more you'll get out of the workshop. So welcome. We're going to talk a little bit about common mistakes that we can all make as Pilates instructors and what some other alternatives could be when we're working with clients that have pain or injury. So, just a little bit about myself. My name is Ariella Hayter, and I began taking Pilates at the young age of 11 years old. I was a ballet dancer, and I had an ankle sprain injury, and I was fortunate enough to go to a physical therapy clinic in Marin County where they actually had someone teaching Pilates and doing some reformer work. And so it became a very regular part of my recovery and rehabilitation for my ankle injury, and has since then become a part of my general conditioning and rehab for lots of different issues. And so I'm deeply passionate about Pilates, not only for my own body, but obviously with my clients and patients. I became a physical therapist in 2002. I graduated from Boston University. And at that time, I was really aware that Pilates needed to be a part of my physical therapy career. And so, after doing traditional physical therapy in an outpatient clinic for 6 or 7 years, I opened and founded Pilates Sante, which we still have today in Los Gatos, California. And it's a rehabilitation studio where we work with clients that have diverse injuries and conditions, a lot of chronic back pain, complex issues, hypermobility, autoimmune dysfunction, pre and postnatal, SI dysfunction, total hips, total knee replacements, all sorts of wonderful things. And we use Pilates to take care of these individuals. So in 2012, I began doing a training curriculum for specifically for the Pilates instructors at Pilates Sante. Shout out to any of you staff that are joining me. Thank you so much for your support. Um, and what that entailed was essentially picking the most common injuries that I think that you'll see as Pilates instructors and creating some templates and some outlines so that basically you have some really good clinical based information when you're working with these clients that come to you that are not just coming for fitness, but coming with different kinds of injuries and conditions. And recently, I've become an associate faculty professor at West Valley College, where I'll be teaching starting in January their injuries and special population courses to their aspiring Pilates instructors in the kinesiology department there. So, what to expect today? Today, we're going to talk about just common mistakes, for lack of a better word, that we can make as Pilates instructors when we're working with clients that have injuries. And then I'll give you some real proven ways to not make those mistakes, and then we'll apply it to a case study at the end. And if all of this work is calling to you, there'll be an opportunity at the end to go even deeper with this work. So I wanted to show a picture of the lumbar spine because as Pilates instructors, you will at some point in your career, if you haven't already, you're going to see someone with low back pain. And I think sometimes it's good just to see a visual of, it can feel very vague and there's many reasons we can get low back pain, but it's more common than the common cold now. And people are seeking Pilates for low back pain. And so what I wanted to do is just create a picture for us that can get kind of clear on what this might look like. If we're working with someone around age 50 or even younger, this can happen. This is an example. This is a picture of an MRI and then a discogram. And you can see the L5. This is called degenerative changes. This is a degenerative disc right here, where you see that it doesn't have that nice white fluid-filled disc that you see in the above segments. And you can see it even more clear in this discogram. And then this patient ended up with so much pain that they finally felt the need to remove this disc and have a lumbar fusion. And some of you may have worked with people that have lumbar fusions, and that's what it typically looks like, where there's a spacer that's often made of cadaver bone, and then there's screws and a small plate. And they go in to try to stabilize this segment that has become unstable and degenerative. And this is very, very common. Okay, so this is something most likely you will see in your teaching career. And so I just wanted to paint a little bit more clear of a picture when you're working with people at back pain of what could be going on. This is just a possibility. And if you don't feel like you have the expertise to adequately serve clients that have a spine that looks like that, that's okay. That's not your fault. Okay. And I really want to share that, it's not your fault because there's a bit of a gap right now in the Pilates industry, I feel. And what I love is that Pilates is so accessible to so many. I mean, the amount of studios we have now and how many people that are both fit and injured are coming to Pilates is amazing. When I was growing up, it wasn't that way. It was far and few between in the 80s. But now it's everywhere. But what that means as instructors is that the training needs to improve because we're going to see more diverse and complex clients. And many of the instructors that are training right now don't have that training because the certification programs don't adequately cover these injuries. And that's just what's going on. And that's okay. But what that means is that we then need to find some additional education. And it doesn't matter what setting we're working in, whether it's a group of 12 people on a reformer or whether you're doing specialized one-on-one sessions, you're going to be working with people that have pain or injuries, most likely. And so rather than having to go access Google or ChatGPT, let's give you guys the skill and the knowledge so that you can confidently work with these clients that are coming in and you can serve them in such an impactful way. And I really firmly believe that. Like Pilates is such a beautiful gift when we do it in the right way, right, with these clients. And so because of this gap, the gap really came clear for me when I started Pilates Santé. And I mentioned that was in 2008. By the time end of 2009, I was like dying for teachers because I had a wait list and I was really overflowing. And that was a good problem to have. But then when I started hiring teachers, what I realized really quickly was that the certification process alone wasn't really preparing them to work with the type of clientele that we were receiving at Pilates Santé. And so this really sparked a mission for me to train teachers. I love it. And like I said, I just feel like Pilates is such a gift if we can use it in the right way. And I'll talk a little bit more about my training program toward the end for those of you that are interested. So some common mistakes, and we're going to break these things down. When we're working with people that have injuries, number one, mobilizing the injured area too soon. Number two, progressing the variations of the exercises and potentially the doses of the exercises too quickly during their injury recovery process. And number three, not fully retraining their poor movement patterns so that they're going out and functioning in poor movement patterns, which is then creating another episode or reoccurrence of their injury or pain. And we're going to break each one of these down. So let's start with number one, mobility too soon. When we are in pain, and we all tend to do this, we want to often stretch the area. It's just what feels like it's intuitive. Oh, it hurts. Let me stretch it. Let me release it, right? But oftentimes, soreness or stiffness does not mean stretching is needed. In fact, oftentimes it can actually make inflamed tissue worse. And what we need to do in those initial phases is actually protect the tissue, calm down the inflammation, and stabilize it. And the beautiful part about Pilates is we can do this. We can teach them how to breathe and activate their deep core stabilizer muscles like their transverse abdominis, their multifidi, their pelvic floor, stabilize an injured area, protect it, and then later we move into more mobilization. I would say one of the number one most common issues when I have an instructor come in and teach me as somebody that has chronic low back pain is they give me something like a standing roll down as one of the first exercises. And the problem with that is that my spine is already moving too much in the area that's injured, and I need to protect it. I don't need to stretch it out when it hurts like that. So, basic rule of thumb is safety, no matter what the general kind of issue is with the back, whether it's a disc problem, a facet problem, a muscle problem, creating control, connection, alignment, and stability prior to mobilizing that tissue is the key. Does that make sense for anyone? And anybody that wants to ask questions or interrupt, please. This can totally be interactive, especially as a small group, okay? So here's just some basic examples. Everybody knows these exercises. And as basic as they are probably one of the most important things you're going to need to have incredible movement observation skills with. Because if you give a client something like a bird dog, and they're not able to stabilize their pelvis in the transverse plane, but then you progress them to something like some form of a lunge series on the reformer or the core line, we're probably not in alignment with where this person needs to be moving in their progression of therapy. If they can't stabilize on a flat, stable surface, why would we then take them to a moving surface upright against gravitational load when they don't have that frontal plane stability? Most likely, if they're a chronic back pain client, they're going to hurt later because they don't have that stability and control for that exercise. So, starting with the basics, which can be so difficult when performed correctly and intentionally, is key. Okay. You can stabilize them in the sagittal plane, right? That's where we start with like our pelvic clocks and our breathing, right? Then our frontal plane movements, and then finally like our transverse plane movements. And all of that kind of control we need to look at in very simple ways before we progress them to more moving surfaces, upright exercises. Again, giving them this basic vocabulary first. Okay. And that kind of ties into the second mistake, which is progressing too fast. And I find with most Pilates teachers, this isn't the dose. It's not like how many repetitions or even the resistance that they're using. It's the amount of variations that they're giving. The beautiful part about Pilates is there's 1,001 variations, which is so cool. Like it keeps our clients, interested for years. Like, right? How many of you have worked with clients for so many years, right? And that's amazing. However, the timing of when you give these different variations is so important. And so what I had Christina make here is a graph. And basically what this shows is it shows kind of the standard expectation of like the client and also of the movement practitioner or the therapist or whoever that's working with the client. And their expectation is we want this straight line of improvement if somebody's got pain injury, right? But often what we see is more of this fluctuating highs and lows. And what's important to understand about that is that we can't just use pain as a guide when we're working with these clients. So I know a lot of, very diligent instructors that are constantly like, how did that feel? How did that feel? Do you have symptoms? And I love that. We're checking in with our client. We're having them be an active part of the care. However, the challenge with that situation is that the majority of clients, the significant percentage of clients that have injuries, particularly chronic low back pain, have latent symptoms. And so we can ask them until the cows come home what they're feeling during session, but they may not know that they're causing stress to their lumbar spine until after their session. It might be hours after, it might be the next day. And so what's so important as Pilates instructors is for us to understand a little bit more about their injury so that we have a clear guideline on their healing time frame. So I'm not going to work with someone that has an acute shoulder tendonitis the same way that I might work with someone that has a chronic degenerative back pain. And so this is kind of like, again, the holes or the gaps that we may not have learned in our training program, where if you have a better understanding of this person's condition by having some interaction with their health practitioner, their physician, their physical therapist, their chiropractor, then you can have a more clear guideline on how to progress them that's not just based off of how they're telling you they feel. You know their condition, and then you're the expert. And then you don't have to worry as much that they're leaving the session and you're going, well, I sure hope they don't have pain later, because oh, we're in week 6 of this person's recovery from the shoulder tendonitis. I know it was appropriate to start giving them some shoulder external rotation exercises with a band or a spring. And so we're in safe zone. It's more of an intentional type of work with the client. So again, kind of just reiterating that progressing too fast is usually adding more variations than a client is ready for. They don't have the control and connection with the ABCs yet, and we start moving into like the D's, E's, and F's. So that's really what mistake number 2 is about, is understanding the tissue that's injured, not relying on pain, and having really, really keen movement observation skills so that you can see, oh, this person doesn't have this control on the mat, so why am I then going to progress them to something more advanced on the springboard or the core line or whatever the equipment is that you're using? Okay. So again, just reiterating, the complexity variations is one way to progress too fast. The dose or the amount of exercises in a session can also be a lot, particularly in a group class. And then sometimes the exercises are just too challenging. So appropriate progression is going to be really looking at how they're moving, the control that they're using in the exercises you're giving them, improve their strength, and then start to increase the dose and complexity. That's the fun part. But let them get the quality of their movement improved first. Okay. And that kind of goes into poor movement retraining. So I personally wholeheartedly feel that as movement practitioners, as Pilates instructors, part of what we need to do is help your clients learn how to move safely, not just during their Pilates exercises, but during their functional activities. And so when you're working with them and you start to progress them in their Pilates program to more functional exercises, really speaking to them about how are they bending, how are they lifting, how are they walking, how are they stair climbing, or whatever it is. Maybe it's sports related. How are you serving, in tennis? What does this look like in your golf swing? Because if we're not able to help them create carryover to their functional activities, they're going to be back at square one eventually with another episode of pain. And that's what we want to try to avoid. And so again, restoring really good, healthy movement patterns. We've started from basic stabilization and control, and then we've moved to more functional based exercises where you're literally watching them do things that they say can be problematic for them, and you're correcting them and teaching them how safely to move so that when they're outside of your session, they're putting money into their bank account versus taking it out. Do you follow what I mean? Like, we want them to have money in their account so that they can write their checks to go play golf and do these things that make their life, make them happy in life, right? So movement retraining, like really fully movement training. And this was something too that quite frankly came up a lot when I worked in the physical therapy clinic. That can feel really discouraging because in some of these outpatient clinics, you're expected to see anywhere from 15 to 20 patients a day. And that gives you 20 to 30 minutes per patient, which is really hard to do some manual work, maybe some soft tissue or some joint mobilization, then teach them a few therapeutic exercises, and then you're supposed to re-educate them about how to move during their functional activities. And it's really hard to fit that in. And so the pattern that you see is that they keep coming back. They come for 8 sessions or 12 sessions, and then you see them a year later, and then you see them a year later. And so that was part of my kind of desire and my, my heartstring pull to start Pilates Sante was I wanted a place that people felt like they could just stay. And we literally have clients from 2008 and 2009 that are still with us that came to us with acute pain after traditional PT and now do this as a part of their maintenance and wellness, knowing that they have chronic issues that they're trying to manage. So, and that's just what's so cool as Pilates instructors is that you can do for these people. So quality of movement is, in my mind, one of the most important things that we need to teach. And part of that is really, really finessing your eye on your observation skills, getting really good at your tactile and verbal cueing, and then knowing how to progress clients toward their functional movement. And again, watching how they're doing these functional movements and correcting them so that eventually they can self-correct and manage their condition outside of their sessions with you. This is one of the things that I find, especially with newer teachers, usually there's a gap. And I think it's just not maybe seeing as many bodies. And over time, as you just see more and more bodies and you continue to train your eye, you'll start to notice, oh, yes, this looks malaligned. This doesn't look like a correct movement. And also doing it in your own body. I can't emphasize that enough. If you don't know what the quality should feel like in your own body, it is so much harder to teach. So as Pilates instructors, it's really our job to keep moving, taking sessions from more experienced teachers that are really articulate with their verbal and manual cueing. It's going to be significantly beneficial for you, particularly as a newer teacher. So what happens when we have these kind of common mistakes occur? We risk client flare-ups and setbacks. Oftentimes this leads to clients canceling their sessions. And then obviously that leads to us having poor retention of our clients, less business, less income. So all of these things to kind of start to add up. And so this isn't to be doom and gloom, but it's more just to understand that, when we can get really intentional with our clients that have pain, injuries, and other kind of conditions, we not only can serve them better in a more healthy and holistic way, but it helps serve for our business, right? And so there's kind of like this great two-way thing that's occurring. So it's really like we're having impact and we're having income, and it's a beautiful circle there. So let's talk a little bit about a case study, and this is where we will get a little interactive. And again, there's no right or wrong, but if people can take part, that would be wonderful. We're just going to use an example that I'm hoping we can kind of apply what we just discussed to this example. So this is a degenerative disc. It's a lumbar degenerative disc client. And she's 49 years old. She's a homemaker, and she's had intermittent low back pain for about 10 years. She did PT, which helped previously, but she's discontinued her home program about 6 months ago. So she's having more pain within recent months. She has pain with household tasks, such as vacuuming and cooking, prolonged sitting, and she's quite stiff in the morning. So let's look at her objective findings here. So when we look at her posture, we see that she has a flat lumbar spine. So she has limited or decreased lumbar curve. She's got some pelvic malalignment. So she's elevated and rotated specifically on the right side of her pelvis. This is a real client, by the way. This is not somebody I made up. And she has hyperextended knees and some pronation in her feet, with her left being more pronated than her right. Don't worry too much about the degrees, okay? These are inclinometer measurements. I put in parentheses kind of normal or limited. That's what's the most important. So her flexion, her forward bend in her lumbar spine is normal, considered normal, okay? Actually, even a little bit increased if 60 degrees is normal, but she's bending well forward. Her extension, on the other hand, is really limited. It's decreased, and it hurts her low back. Her side bending is slightly limited. It's 25 to 30 is considered normal. Her left is limited. When you look at her flexibility, she's got about 70 degrees of hamstring length bilaterally, which for a female can be considered limited. I'd like to see a little bit more than that. Her hip flexors, about 15 to 20 degrees is normal, so she's a little limited, particularly in her left hip flexor. And then her gluteals are quite limited, like her rotation. When we looked at prone hip internal rotation, we'd like to see about 40 to 45 degrees, and she had between 30 and 35 degrees. So there's some flexibility issues there. In terms of her functional movement, her squats, she has a pretty good hip hinge, but she is elevated in the frontal plane, so her right ilium is elevated. Her balance is a little bit limited on her right. And then in terms of her gait mechanics, she's got, again, this excessive frontal plane pelvic movement that's happening in mid-stance. Her stride length is a little bit short, and she still has that excessive pronation that we saw just in standing. Does this feel, I know case studies are new to some, does this feel pretty clear? Does anybody have any questions about just sort of how this person's presenting right now to us? Okay. So in terms of this homemaker, this 49-year-old homemaker, what goals do we want to consider for her? What does she want to, what do we want both from a functional standpoint and from an objective standpoint, from her objective findings? What mistakes do we want to avoid with her based on what we've learned today? And then let's think about some exercises that we might want to give this client, at least initially, to start. Does anyone want to shoot out any ideas? It's totally okay to just unmute yourself. Ideas about what goals we might want to consider, either from her objective exam, like her mobility or functional movements, or from a functional standpoint. What do we want for this person? What would we love to give her? Anybody?
We want to increase lordosis.
Yes.
Lumbar spine.
Yeah. Yeah. What we know about not having enough curvature, and there is definitely debate on how much is appropriate, but if we have flat spine, we know that our discs are more vulnerable to degenerative changes. So having curvature in the spine, there's a purpose for it. It allows for shock absorption. It allows for better dynamics of that vertebral segment. So when we have a flat spine like she does, we might want to encourage, well, maybe we can start to, it might not be day one, but encourage her to have more curvature in her spine to prevent future episodes of pain. Yeah, that's good. Thank you. Anybody else? Any goals that we might want for her?
You can also think about unloading and stabilizing her low back. So unloading would be important for her.
Yeah, definitely. In terms of, I like that. And that's going to be more about like what you're going to apply in your Pilates program. But in terms of like goals for her, like when you look at the exam, what do we want to increase or what do we want to improve in her posture, in her lumbar range of motion, in her lower extremity range of motion, her functional movement?
Yeah, so increase, for example, hamstring flexibility because she's a little limited. She
Yeah.
already mentioned the lumbar curvature, definitely improve balance,
Mm-hmm.
enhance her gait, right?
Yeah, these are all good things. And I think what's important too is just to think about what might help this person the most initially. And this is where it gets a little bit more of a nuance here because you guys are all throwing out great things. She's got deficits in a bunch of different places, like many of our clients, like many of us, right? But what do we think is going to make her feel significantly better soon? Maybe the hamstring and glute stretching and stabilizing your low back. She clearly has a lot of lumbar flexion mobility. I didn't really put it in this slide, but she kind of had excessive mobility. I mean, not considered hypermobility, but could flex quite a bit and then had like no extension. So very much imbalanced in her ability to move in her spine. So yeah, these are all really good. And then from a functional standpoint, right now, she's a homemaker and she can't vacuum or cook. So those are important things that you want to be checking in with your client. If they come in and say, like, I'm here because I was told Pilates would help, I've done a lot of physical therapy, but I still struggle to do the basic household chores. That's really your job to be checking in with that person and saying, okay, after you've been working with them, so how is it going? Are you able to sleep through the night better? I mean, for example, if they had trouble sleeping, are you able to now stand and cook a meal for your family without pain? Like these are such big wins for these clients and you get to take part in this, but you need to know what those kind of issues are first, right?
So can we talk a little bit about, and I hope I'm not jumping ahead. If I'm in, you'll let me know.
Okay,
Can we
yeah,
talk a little bit about, so we're talking about stabilizing her during her session. What would be, sorry, this is why I'm on mute, my dogs. What would be helping her, what could we give her for at home to help her stabilize in those movements that she's doing at home, the vacuuming? How can we help her stabilize while she's doing that?
that's a really good question, Abina. So yeah, let's go on to, okay, let's address it. So first we'll just look at what I wrote for goals. To restore her core control and lumbopelvic stability, increase her lumbar lordosis, restore her flexibility of her hamstrings, hip flexors, and external rotators, and restore her gait mechanics. But what's not here and really important is that we do need to restore her ability to do functional activities. So to answer your question, Abina, when you start stabilization in Pilates with someone that has low back pain, initially it may not look functional, right? You're lying on your back. You're oftentimes teaching them how to move their pelvis to change the position of their lumbar spine. You're teaching them how to breathe. You're giving them basic exercises like a hook lying march, toe dips. Maybe we're challenging them into a 90-90 isometric press or dying bug variations, right? We all have different terminology for this. That's not necessarily functional, but it's what someone with chronic back pain needs. As they show control and stability and start to improve in these less functional positions, right? Bridges, sideline hip work, bear planks, things of that nature. Then, as we move through to week 4 to week 8, we're giving them more functional things. So, for vacuuming, for something like vacuuming or cleaning, doing something like this is a rotational movement. It causes rotational stress to the spine. So, anyone want to offer what would be an exercise we could possibly give them that might be like an anti-rotation exercise, an anti-rotation stabilization that might prep their muscles to be able to tolerate something like vacuuming or cleaning? Any thoughts? You know, it's hard because we have so many options in Pilates. Standing.
Like an external rotation?
Yeah, or cross body movement, anything. Standing springboard work is awesome. So cross body pulls from different angles where we're telling her, hey, we don't want you to move your pelvis. We want you to keep your ribcage stacked over your pelvis, and we're anti-rotating. And then once she can do that without symptoms and feels really good, then we move her into rotation and we teach her how to rotate safely from her pelvis, from her thoracic spine, not from her lumbar spine. Does that make sense? And so then I hope that makes sense to Bina. So then basically she's now moved from a less functional stabilization to a more functional stabilization. I love kind of mimicking, like making up exercises in Pilates that mimic what the client needs to be able to do. Like I grew up dancing, so I don't know sports very well. So anytime I'm working with an athlete, I have them send me videos, but I also will just say, hey, show me the most aggravating movement, or show me something that's the most challenging for you given your condition. And then we try to develop these exercises based off of it. It's actually kind of fun. You know, you can really be creative. That's what's just so cool about Pilates. So does that make sense for everybody? Yeah. Okay. So mistakes we want to avoid with this client, just based off of what we learned so far today, is that we may not want to start with spinal mobility, right? Even though she's saying she's stiff, you know, starting with a bunch of extension, like a cat-cow variation, might not feel good right away, okay? So we want to avoid doing that and instead start by teaching her how to position her back and pelvis better, teaching her how to engage her transverse abdominis, her multifidi, her glutes, et cetera, et cetera. We don't want to advance our exercises inappropriately. 100 is a really good example of this. I don't want to say that 100 is a bad exercise. 100 can be an amazing exercise. But what we have to consider when we're teaching someone full 100, where we have both legs out long in a bilateral straight leg raise, is that the majority of the clients that we work with don't have the core control to do that without adding stress to their lumbar spine, even if they're not experiencing pain. That's what's so challenging, is that if we base it all off of pain, we're not servicing our clients well, because a lot of people can do full 100 and say, oh, this isn't hurting my back, I'm doing fine. But long term, we're really not doing them service. Instead, can we challenge them with their legs in 90-90, doing a chest lift variation, supported? Can we use the Gertie ball? There's all these other ways that we can not load and stress the spine and challenge them to a point of like quivering, right? So, and then we need to address her posture and how she's walking and her functional movements. These are the mistakes we want to avoid in order to really do our due diligence with this client. Does anybody have any questions about that? Does this feel pretty clear?
When you're working with the client with regards to, okay, cooking at home,
Yeah.
do you ask like, what shoes are you wearing? Because I mean, to me, that's made a huge difference if I wear like Keens. They're ugly, but they provide really good support when I'm in the kitchen. And then, I mean, that's gotten rid of my back pain when I'm cooking. So do we go into that level too?
You can. I mean, it definitely depends on the setting you're in. And but if you're working in a private session with someone, yeah, like these are things where you're going above and beyond and you're creating trust in a relationship with this client, you know, and then they become your client for good, you know, and then they start referring their friends and families because they trust you as somebody that she listened to me, you know, more than any other practitioner has ever listened to me about my back pain. And she helped me be able to do what I want to do. So yeah, you can talk about that and standing on like a cushioned mat in the kitchen, you know, and how should she position her pelvis? But yeah, all of those details are wonderful. I love it. Like, let's service these people. Let's give them what they really need. That's good, Shannon. Okay, so week 1, this is just a picture of me doing something probably more advanced than what I might particularly give this client. But I just wanted to give you an idea that here I'm doing like an anterior oblique kind of dying bug variation. But again, just getting the concept that let's teach her how to protect her back initially versus stretching it. Okay, guys? Then as she starts to have more control and she starts to move better and maybe feel better, then we start to progress to some extension. And this is a great place to improve lordosis. Carla said, or actually Sarah, let's improve the lordosis. What's so cool about hands and knees is we don't have the gravitational load. This is a lot different than if I'm in prone trying to increase extension. It's also a lot different than if I'm in standing trying to increase extension. Here you can create a lot of length. You could even, I could have done this too, with my hands on a push-through bar, doing cat on the trap table, getting an axial elongation using the push-through bar, and then encouraging lordosis in my lumbar spine. Does everybody see that? There's a lot of hair in that picture. I should have had it up. Okay. All right. And then week 8. So now this is where we start to get into the fun whole body exercise movements. This is me on the right on the core line, just doing lunge type movements. This is how people get on and off the floor, right? This is like my go-to when it's working with older clients. I have clients all the time coming in saying, I live by myself. I'm so scared I'm going to fall and not be able to get back up. And like they need to know how to get on and off the ground. But it doesn't have to be fancy on the core line. It can just be on the mat, or you can use the springboard. And here I am just doing arms facing forward, doing like a hug a tree variation. And we could do this unilaterally, so many variations. We could do line of pull from higher, line of pull from lower. That's the beauty of this work, is just watch the client move, and based off of how they're moving and what they need to be able to do, adjust the exercise to meet their needs. Okay, so the big key take-home message here is really understanding the client's injury and condition. So if you need to get more information by talking to their practitioner, their health practitioner, do it so that you can kind of get an idea of like, where are they in this healing time frame? So that you're not just approaching your sessions thinking, how am I not going to hurt this person today? We don't want to approach it like that. We want to approach it as, how am I going to help this person today? And then we're going to really look at quality of movement and how do we progress the exercises based off of how this person is performing this exercise. I don't want to go progress that exercise if they're not doing the fundamentals correct. That's really, really important. And then I want to address their poor movement strategies, especially that might be in their functional activities. Okay. So the question I ask is, do you feel like now you have some tools that you might want to make or use to make some changes in how you approach your clients that you're working with that have pain or injuries? Because you're going to see a lot of injuries as Pilates teachers, and this is not to overwhelm you. And some of you are probably already seen a whole bunch of these, but you're going to see lumbar spine, degenerative changes, cervical spine. You'll see some SI dysfunction, some hip, maybe some labral tears or arthritis. Maybe even some of you have worked with people that have joint replacements. You'll see knee pain, like patellofemoral pain and meniscus tears, and you'll see shoulder tendonitis or impingement. These are all things that you'll probably see at some point during your teaching career. And so the question is, do you feel comfortable working with these clients? And if the answer is no, that's okay. That's really okay, because we talked about that gap. And if you can see this little diagram that Christina made, I'm really trying to help fill this gap. And so I'm passionate by filling this gap, or to try to fill this gap, with the Clinical Instructor Academy. And so I've developed a program that's a training and mentorship program. And what this training and mentorship program does is it gives you specifically indicated exercises and exercise programming progressions for all of the injuries that we previously mentioned. So that, again, you're not just going in with the information of what not to do, you're learning about what to do. Okay. So the content, and I hope this table is like not too overwhelming. Basically what this program is it's a 6-month program where you have online educational modules that go over anatomy and biomechanics briefly, but then go over numerous conditions and injuries, explaining what are those injuries, how do they occur, what do they present like, and then what Pilates exercises you don't do with them, what Pilates exercises you do with them. You'll practice client case studies. you'll have video demonstrations of how I like to teach clients that have these injuries. And then you'll have weekly calls with me that's included in this. It's self-paced curriculum. However, we do have like a timeline we're sort of following, but you certainly can go at your own pace and you just take whatever you need to get from the calls, even if you haven't hit that chapter or module yet. So these are the conditions that we cover in Clinical Instructor Academy. 6 months and 6 body parts. I know it kind of looks like a lot. I was really excited about this. And so as we go through this first cohort, we're going to see how far we get through and if there's too many injuries and conditions in it. So, but I really think that these are things that you're going to see. I think you'll see a lot of people that have chronic degenerative meniscus tears. And what should I do with these clients? People that have cervical disc herniations or they've been in motor vehicle accidents, shoulder tendonitis, shoulder bursitis, things of that nature. So who is this appropriate for? This can be for teachers that are just starting out or that I've been teaching for a while. And the reason that is that all you need to know is the basic fundamental Pilates exercises on the majority of the equipment. What I'm not teaching you is what you learn in your training program, which is here's the reformer exercises, here's your top table exercises. Instead, what I'm teaching you is here's the injury and condition, and here are the different pieces of equipment and exercises that might be appropriate for that condition at this phase of their healing program, okay? This can be beneficial for someone that's teaching group, that's teaching private. You want to grow your credentials. You want to be able to work confidently with your clients so you're not going into these sessions worrying about hurting someone, which is just the worst. You want to boost your clientele. You want to grow your business financially. And most importantly, you want to have a greater impact on these clients' lives. That you want to not just give them a 6-pack. You want to help them feel less pain. You want them to be functional. You want them to have a better quality of life. Okay, we have 3 spots left in the fall cohort. There's only a handful in the fall cohort, which I made specifically because I really, really wanted to have this be a mentoring experience so that I can be available to you to answer your questions, to have this be the more personal educational experience. Okay. So the couple different ways to enroll, there's QR codes for 2 different things. One is you can just fill out this application form and we can look through the form of these questions that we made and we can decide if this is an appropriate fit and enroll you. Or you can just book a call, and on the call you can talk to me about your goals, like as a Pilates instructor, and we can think about a plan and whether CIA is actually appropriate for you at this time. So either one works, 2 different QR codes. And I think Christina is going to drop something in the chat that also has some links. Okay, yeah, good. Bonus would be my book. I have a book that's specifically on the lumbar spine that goes through a lot more conditions than what we talked about today. And you can buy it on Amazon. If you join my cohort, you'll receive it for free. In fact, Abina, I think you might still need a copy of that. I'm not sure if you've gotten a copy.
No, I didn't. Thanks for thinking
cool.
about me.
Okay, yes.
My fault, Abina. I'll get that to you right after.
I know you will, Christina. Thank you so
Okay,
much.
good.
All right. Does anybody have any questions about what we talked about with like common errors or the Clinical Instructor Academy? No? Okay. If any questions do come up, please feel free. Yeah, go ahead.
Patty
Christina.
does have a question. She did raise her hand.
Yeah, talk, Patty.
Hi,
Hey.
Ariel and Christina. It's been a while. I guess remind me, so this program is self-paced, but is there like a expiration point or something, or do I have this forever, basically?
Yeah, that's a good question. So it's no, you don't have it forever. For the first cohort, I think Christina, and you can confirm with this, what we've decided to do is like I'm available to you for the first 6 months. And then you'll have access to the material for 1 year. Yeah.
Yes, that's correct. Correct info.
Got it.
Yeah.
And then I guess when you were putting this together, what were you hoping regarding like the calls to be mainly focused on?
So each call that we do each week, well, it's Q&A. So anybody that's going through the curriculum, they can come with whatever questions they want. Like I'm completely accessible to you. So if it's like a personal client that you're challenged with, I can help you with that.
Okay.
Right now, what's been happening is less of that and more of people saying where they're at in the curriculum, and then us digging deeper into it, like going through the case studies. And essentially what I did was I took the Pilates Santé training curriculum that I had began developing in 2012, and I blew it up like exponentially. Like I took it into a much deeper, higher training level.
Mm-hmm.
And so that's what this program is. And I also just took the injuries that I felt were like the most
Common.
Yeah, exactly. Yeah. So that's how the Q&As are. I mean, the calls are working right now. Technically, they're an hour and a half allotted every week, but you don't have to join them if you don't want. They're recorded, and I'm completely accessible to you as a mentor, essentially. Mhm.
So the calls are like group calls, or are they
Yes.
one-on-one calls?
Yeah. Group calls. Yep.
Oh, and what if we cannot make it during that time or
So
day?
the calls are recorded. And then I'm accessible right now to this small cohort with email anytime.
Got
So I like anytime if somebody has, and I'd be even willing to hop on calls and stuff if people couldn't make the regular call. I'm really intentional with this first go round that everybody goes deep, and that I'm there for them. So yeah.
Sounds good.
Yeah, I don't know how intentional cohorts will go. As I mentioned, I start teaching at West Valley in January, and so my time is going to be more limited. I do know that there'll be future cohorts. I just don't know that they'll be organized in the exact same way.
Congratulations, by the way. They definitely need someone like you at West Valley.
Oh, thank
I didn't know
you.
you are studying there. That's awesome.
Oh, thank you so much, Patty. Okay. Any questions from anybody else? Yeah.
I have one question because I wonder if it may come up with some people watching the
Okay.
recording, Ariel.
Yeah.
So you talk about progressing like intentionally.
Yes.
How would these instructors handle their clients trying to push some of these common mistakes on them? What would be your suggestion for those instructors?
Oh, wow, that's a really good question. Yeah, I think that's where you sort of have to position yourself a little bit more as the expert, even though it's a working relationship and it is customer service, but really educating the client that you understand their condition and that at this phase of where they're at, given their condition, that you want to keep it more safe. And most of the time, they're very, very open to that. And safe doesn't mean easy, you guys. That's what's just so cool about this work is we can totally challenge our clients. I mean, really challenge them doing things that don't have to be fancy. That's where we get really intentional and methodical with how we're cueing them, and how they're moving. Don't let them move messy. In a friendly way, like we really clean up their movement patterns and make them quiver, make them shake, make them get fatigued, but doing it all in a really safe way that's in alignment with where their condition is in their rehabilitation journey. Yeah. I hope that answers the question. Yeah. Okay. If more questions come up, please let me know. Thank you so much for joining in person, you guys. And it's just so nice to see faces too. So yeah, thank you, thank you, thank you. All right. All right. You guys have a great rest of your day.
Thank you. It was
Okay.
great.
Okay. You're so welcome.
Thank you.
Okay. Bye-bye.